Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, Chief Medical Officer of Health, the Honorable Dominic Cardy, Minister of Education and Early Childhood Development, and the Honorable Blaine Higgs, Premier of New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole de la séance d'information de cet après-midi. Le Dr. Jennifer Russell, médecin hygiéniste en chef, le ministre de l'Éducation et du Développement de la Petite Enfance, l'Honorable Dominic Cardy, et le Premier ministre du Nouveau-Brunswick, l'Honorable Blaine Higgs. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Good afternoon, everyone. Bonjour à tous et à toutes. We are now entering a new phase in our effort to slow the spread of COVID-19 in New Brunswick. While the order went into effect last Friday, today is the first day for many New Brunswickers to experience the reality of wearing a mask when in public. It does take some getting used to. I felt the same way when I started making mask wearing more regular. Je vous demande donc deux choses aujourd'hui. S'il vous plaît, soyez vigilants et bienveillants. Il est essentiel que chaque personne dans chacune des régions de la province se conforme aux nouvelles règles sur le port du masque. La COVID-19 est de retour parmi nous et nous avons tous un rôle à jouer pour ralentir la propagation. C'est vrai que les masques sont une des choses qu'on a pour nous protéger. C'est une des choses comme les frontières, comme la distanciation physique, comme le dépistage, rester à la maison quand vous êtes malade, etc. Alors, c'est pas juste une chose qui va nous donner le succès. C'est toutes les choses ensemble qui vont donner le succès. Puis le succès, vraiment, le but, c'est de rester en jaune le plus que possible jusqu'à le temps qu'on a un vaccin. Dans vos milieux de travail, vous devez porter un masque chaque fois que vous risquez d'être en contact étroit avec d'autres personnes, comme dans les salles de réunion, les corridors, les salles de pause et les toilettes. Ne donnez pas la chance au virus de se propager, parce que si vous êtes en contact avec les gens plus que 15 minutes à moins de 6 pieds, c'est dans ce temps-là que la transmission de COVID-19 peut arriver. Partez du principe que le virus est présent, peu importe où vous êtes, et utilisez votre masque pour vous protéger et protéger les autres, parce que c'est une pandémie mondiale et il y a des cas tout alentour de nous. D'autre part, il est important d'être bienveillants les uns envers les autres. Aidez vos collègues à s'adapter au port du masque et faites preuve de gentillesse à leur égard. Il y en a des gens que c'est vraiment, ça cause beaucoup d'anxiété de porter un masque. Peut-être ils ont besoin plus de réassurance, peut-être ils ont besoin de plus de support et de compréhension et vraiment pour essayer de leur soutenir. Soyez un modèle pour ceux et celles qui oublient de mettre leur masque ou sont réticents de cette idée. Encouragez-les à vous aider à protéger l'ensemble de la population du Nouveau-Brunswick, comme c'est une des choses qui va nous garder tous en la phase jaune jusqu'à temps qu'on a un vaccin. On sait qu'on va avoir des éclosions. C'est pas possible d'avoir une pandémie mondiale sans avoir des éclosions de temps en temps. Nous, on espérons que les éclosions seront une durée très courte et que le moins nombre de personnes sont impliquées que possible. Et les masques sont très importants pour nous aider avec cette but. En portant un masque, nous protégeons nos familles, nos amis et les membres les plus vulnérables de notre société. C'est pour assurer leur sécurité que nous déployons tous ces efforts. It's absolutely vital that everyone in every region of our province adhere to the new mask rules. COVID-19 is with us, and we all have a role in slowing its spread. In the workplace, you must wear a mask in every situation where you will be in close contact with others in meeting rooms, in corridors, in break rooms, and bathrooms. You really want to protect each other. 6 feet of distancing, you can be within that. If you are within that for 15 minutes without a mask, that is when the transmission of COVID occurs. We must wear our masks. Don't give the virus any chance to spread. It is a layered approach. We have our border measures, we have physical distancing, we have limiting our bubble numbers, we have hand washing, we have masks, we have testing, we have staying home when you're sick. All of these things together need to happen to protect all of us so that we can stay in the yellow phase as long as possible throughout the duration of the pandemic, if possible. And if we do have outbreaks, that they're short in duration and they have the least number of people impacted as possible. By wearing a mask, we are protecting our families, our friends, and the most vulnerable members of our society. It's to keep them safe, and we are all working so hard for this. We want to keep our economy going. We want to keep our schools open. We want to protect our mental health, and all of these things combined together will allow us to function in the yellow phase. And if we do have outbreaks, that we shorten the duration and get out of the orange phase as quickly as possible and not have to go into a red phase. Today, it is our vulnerable elderly population who are the focus of our efforts in our adult residential facilities, long-term care facilities, etc. J'annonce aujourd'hui une éclosion de COVID-19 au manoir La Sagesse de Hamilton, un établissement résidentiel pour adultes. Un cas de COVID-19 a été confirmé à cet établissement. Today, I am declaring an outbreak of COVID-19 at the Manoir de la Sagesse, a special care home in Hamilton. We have confirmed one case of COVID-19 at this facility. We're taking aggressive steps to limit the impact of this outbreak. We're doing mass testing as of this morning at the Manoir, so the residents and staff are all being tested today. And they will be tested on a regular basis, just like at the Manoir outbreak in the Moncton region. So every couple of days, we will continue to do that testing, and as cases are identified, their close contacts will be contacted and isolated. A Provincial Rapid Outbreak Management Team, PROMT, is now at the Manoir de la Sagesse to focus our resources on limiting the scope of the outbreak. The PROMT team is working with facility staff, extramural, public health, regional health authorities, government departments, and regional services to respond to this challenge, just like all of the other outbreaks. Same kind of teams, same kind of response, and try to limit the spread and limit the impact on the community. As with the Manoir Notre Dame outbreak in Moncton, we're applying the lessons learned in the first wave of COVID-19 to effectively manage and limit the impact of this outbreak in an adult residential facility. By moving quickly, we can slow the spread of the virus among residents and staff while ensuring continued quality care and attention to those in need. J'annonce aujourd'hui qu'il y a 6 nouveaux cas de COVID-19 dans la province. Ces nouveaux cas sont liés aux éclosions dans les zones 1 et 5. Voici les nouveaux cas. Un cas dans la zone 1, région de Moncton, touchant une personne âgée de 70 à 79 ans. 5 nouveaux cas dans la zone 5, région de Hamilton-Restigouche, dont celui au manoir La Sagesse, dont je vous ai parlé tout à l'heure. Une personne de moins de 19 ans, une personne âgée de 30 à 39 ans, une personne âgée de 50 à 59 ans et 2 personnes âgées de 60 à 69 ans. 5 personnes sont actuellement hospitalisées, dont une aux soins intensifs. Il y a eu à ce jour 284 cas de COVID-19 au Nouveau-Brunswick, dont 82 sont actuellement actifs. Today, there are 6 new cases of COVID-19 in the province, and these new cases are related to the local outbreaks in Zone 1 and Zone 5. The new cases are as follows. 1 case in Zone 1 in Moncton affecting an individual aged 70 to 79. There are 5 new cases in Zone 5, the Hamilton-Restigouche region, which includes the case at Le Manoir de la Sagesse, which I spoke of earlier. 1 individual under the age of 19, 1 individual aged 30 to 39, 1 individual aged 50 to 59, and 2 individuals aged 60 to 69. There are now 5 individuals in hospital, one of whom currently requires intensive care. To date, we have reported 284 cases of COVID-19 in New Brunswick, of which 82 are currently active. This latest outbreak at a senior's home is yet another stark reminder of the threat posed by COVID-19 and the ease with which it can spread, and the impact it can have on so many families and their loved ones. Again, with their contact tracing, everybody who is affiliated with any of the cases are contacted and would be self-isolating, and we will be watching them for 14 days to see if they develop symptoms, and we will be testing them. It illustrates how quickly the virus can move to new hosts and the absolute necessity of adhering to all the measures that will slow its spread. It may seem unnecessary to some to wear a mask when you're out of view of the public, and it will be tempting to ignore this rule in the stockroom, in the warehouse, in the meeting rooms, and with colleagues that you have known and worked with for years. It is really, really important that we take this very seriously. So we can't really afford to cut any corners or take any chances. I've told people in the past that, we're throwing everything, including the kitchen sink, at this, and we don't have a choice because we are a small province, and we really have to protect our human resources, and we really have to protect our hospital services, as well as protecting our mental health, because nobody wants to be in an isolation unnecessarily, and nobody wants to go into orange or yellow phases unnecessarily. Certaines personnes considèrent peut-être qu'il est inutile de porter un masque lorsqu'elles sont hors de la vue du public. Par exemple, on peut être été tenté de ne pas porter le masque dans les entrepôts ou dans la salle de réunion avec les collègues qu'on connaît et avec qui on travaille depuis des années. Mais dans la situation actuelle, personne au Nouveau-Brunswick ne peut se permettre de tourner les coins ronds ou de courir des risques. On ne peut pas. On ne peut pas. People move around and the virus will move with them. Today, families have returned from Thanksgiving weekend celebrations from every corner of the province, and it is certainly possible that a colleague or close friend unknowingly has brought the COVID-19 virus with them. This can happen, so why take a chance? We really need everyone to wear your mask in every location where you may interact with people. This rule applies to all indoor spaces and regions in the yellow phase of recovery and to all indoor and outdoor spaces of zones 1 and 5, which are in the orange phase. And remember that wearing a mask is the most effective when done with the other measures. It's a layered approach. So we have to make sure we continue with hand washing, sneezing or coughing into your sleeve, cleaning commonly touched surfaces in your home, and so on, staying home when you're sick, getting tested, etc. It's important to wear your mask properly, make sure it's clean, and make sure you have it on you at all times. Je demande aussi à tout le monde d'être honnête, en particulier lorsqu'il est question de la recherche de contacts. Si la santé publique communique avec vous, n'hésitez pas à dire la vérité quant à vos déplacements. Vous ne serez ni pointé du doigt ni culpabilisé. Au contraire, le fait d'être transparent quant à vos déplacements pourrait nous permettre d'exclure la transmission communautaire de la COVID-19. C'est pour ça qu'on cherche des contacts étroits qui ont voyagé, parce que c'est ça qui va nous dire que c'est quelque chose lié au voyage et non pas la transmission communautaire. La transmission communautaire est vraiment dangereux parce que ça veut dire qu'on ne peut pas faire tout le traçage des contacts, on ne peut pas faire toutes les recherches, et ça veut dire que c'est un des déclencheurs pour aller dans la phase rouge. S'il y avait 3 chaînes de transmission communautaire dans 6 jours, c'est très, très, très important qu'on sache où le contact a été avec le lien de voyage. Votre honnêteté et votre coopération pourraient donc nous éviter d'avoir à imposer des mesures encore plus strictes contre la COVID-19. Alors, c'est vraiment important que tout le monde soit à la même page avec la communication, la manière qu'on a les places de conférences et l'information sur notre site Web. Il y a beaucoup d'informations sur notre site Web. C'est un endroit crédible qu'on peut trouver de l'information. J'aimerais que vous cherchiez votre information là. Et si vous avez des questions, il y a des endroits où vous pouvez demander par courriel ou par le téléphone. On veut répondre à toutes vos questions parce qu'on veut que vous avez l'information qui est à jour. Being vigilant against the spread of COVID-19 requires that we all work together. We can't leave this for others to do or assume that we are somehow exempt from the impact of the situation. And if we take COVID-19 for the serious threat that it is, we can slow its spread. We have been very successful up until now. We have had a unified approach. We have had the trust of the public and the cooperation of the public, and I am so proud of everything that we have been able to accomplish together. And we can reduce our case numbers over time. In this particular situation, we can protect the most vulnerable members of our society. society. And for them and for all of you, that our team at Public Health is working today. We are working so hard to make sure that we protect every person in this province, but we need your help to protect each other. Please work with us, and I know that we can get through this together. Un gros merci. Thank you.
Good afternoon, everyone. Bon après-midi, bienvenue. So get into the difficult details first. Positive case of COVID-19 has been confirmed at Dalhousie Regional High School. And late yesterday afternoon, school communities were also made aware of possible exposure to a COVID-19 case at a number of Campbellton schools, including the Lord Beaverbrook School, the Campbellton Middle School, and Campbellton Learning Centre. Dans tous ces cas, on demande aux familles de rester vigilants. S'il y a quelqu'un dans ta famille, dans ta communauté qui a les symptômes, s'il vous plaît, allez prendre un test. Si vous étiez en contact assez proche avec quelqu'un qui avait besoin de prendre un test, ou qui était isolé pour n'importe quelle raison liée au COVID-19, tu vas être contacté par la santé publique pour aider dans le processus de tracer les contacts. So as always, we're committed at the department and across government, working with Dr. Russell's team, to protecting the privacy of our students and staff. So one thing I'd ask all parents especially to remember is that no news is good news, that if you don't hear anything from public health, they do not have the time or resources as they engage in an aggressive program of contact tracing and all the other work they have to do to try and keep us safe and help us ride out the second wave of the pandemic, that they're not able to call every single family with every single update. So as the doctor was saying, please refer to these press conferences, to information available online to get reliable, accurate, and up-to-date information about the progress of COVID-19 in your province and in your community. Nothing else is going to give you that information. So in terms of learning at this time, we don't anticipate changes or any impacts at the Lord Beaverbrook School, at the Campbellton Middle School, or the Campbellton Learning Centre. But of course, if that changes, if we have confirmed cases, the folks in those school communities will be the first to know. Students at Dalhousie Regional High School are going to be learning from home today and tomorrow as contact tracing is carried out, so that staff are able to implement their operational response plan. So anytime if we have staff members, because it's not just students, of course, we're concerned about in the school system, it's the staff and the rest of the professional team, and they are equally vulnerable to the illness and could easily be taken out of school as they wait to get tested and wait for their results, as others are having to go through that process now. So please be patient and calm there, but we will do our best to get back to regular learning at Dalhousie Regional High School as soon as possible too. So with all that said, look out for communications from public health. That can come through your school, come through the district, or might come from public health directly. We're going to continue again to provide you with as much information as possible. And I want to reiterate something because I'm continuing to see on social media and in the mainstream media misinformation, partial truths being shared that actively damage our province's response to COVID-19 and actively endanger the lives and safety of people in this province. So there's been a lot of illustrations to comparing COVID-19 to a war against the virus. And one of the ones I think is most appropriate there is some of those lines from past wars. We talked about loose lips sink ships, and sharing information that gets out there that can actively undermine your own side's effort. That happens in this case. Every time a rumor starts on social media that then turns into an interview on the radio, that spreads misinformation, that takes time that Dr. Russell and her team and resources that Dr. Russell and her team need to fight COVID-19, and they have to spend that time fighting misinformation instead. So misinformation is a symptom of COVID-19, and all of us have a role in stamping it out. And that means listening to the information that comes through these news conferences, referring to the government website for accurate, up-to-date information, and not sharing information that you don't know for sure is real or true. Because every time that happens, it makes our province a little bit weaker. Je veux renforcer ça qu'on a besoin de cibler l'information qui est vraie et vient des sources fiables. Comme ces conférences de presse, les paroles du hygiéniste en chef, du Premier ministre, l'information qui est données sur les sites web des différents ministères. S'il vous plaît, prenez l'information de ces sources parce qu'ils sont fiables. Chaque moment que l'équipe de Dr. Russell a besoin de prendre pour pousser contre la malinformation, ça c'est un moment où ils ne sont pas dédiés à leur travail primaire, de pousser contre le virus. Alors pour moi, de mon avis, la misinformation, la malinformation, c'est un symptôme de COVID-19. Et on a besoin d'agir comme ça, de la même manière qu'on agit contre le virus propre. So incredibly grateful to the work that's being done by Public Health and our return to school plans developed in conjunction with Public Health and the Health Department. We're doing our best to minimize risk and maintain schools that are open and safe. On veut assurer que les écoles restent ouvertes et que les écoles restent sécuritaires. Ce sont nos deux buts et ils sont égaux et on le pousse à la même temps. Les plans opérationnels étaient divisés par l'équipe scolaire dans chacun de à peu près 300 écoles partout dans la province. Ils sont individualisés parce que les conditions spécifiques existent dans chaque école. We've heard throughout this pandemic about the incredible collaboration between students and staff. And this is a moment for me in the middle of this difficult part of this fall to thank the students and the professional teams and all the teachers who worked to make our return to school in September relatively hassle-free. I know the incredible stresses teachers have been under and the work that's been asked of them above and beyond anything they could have signed up for when they started down this career path. But I know that their students and a grateful province will always remember the commitment they've shown and the sacrifices they've made, from early childhood center operators opening back up in the teeth of the pandemic in March and April, to teachers taking their students back into school, to janitors keeping those schools clean. The work that's been done is incredible, and I'm very proud to be part of that team. But we know that when folks leave the classroom, it's been easy to slide into, say, a false comfort. That we've seen across Canada and around the world that COVID-19 in a classroom setting hasn't necessarily spread in the classroom. It's spread in other facilities, in break rooms, moments outside class. So I urge every adult in our school system to take every precaution possible, not just to protect your school and the kids that you love, but also to protect your families and the community and your province around you. And the best way to do that is to follow the advice of public health. Wear a mask at all times, indoors in the yellow zones and indoors and outdoors in the orange zones. Hand washing, physical distancing, the routines that we've all gotten used to these last few months. These aren't things that we stand here and say for our health. We say it for the health of all of us. And we want to get through this as quickly as we can. We want to end these restrictions as quickly as we can for everyone in our province, the same way everyone around the world wants to put an end to this pandemic. But the way we get there is by following the guidelines from public health, because otherwise it's on all of us if this virus continues to spread. And it's on all of us, the consequences of what will happen in that case. So please listen to public health and follow the guidelines. You don't know when someone has COVID-19 unless they've had a test. Someone you know, someone you see every day is as likely to have it as someone you meet on the street for the first time. We have to assume risk for a short time so that we can go back to living a normal and happier life afterwards. On a besoin d'être vigilant en les salles de classe et en dehors. On a besoin de faire tout qu'on peut pour assurer la sécurité et la santé de nos écoles. Il y a à peu près 120 000 Néo-Brunswickois, Néo-Brunswickoises qui entrent et parlent le système scolaire dans toutes les écoles, les bureaux de district, etc. chaque jour. C'est un grand pourcentage de notre population. Et jusqu'à ce point, toute cette équipe a fait un travail assez super pour limiter les éclosions dans notre système. Mais encore, avec tout qu'on peut voir dans la région 5 et 1, le virus est toujours là et on a besoin de prendre les mesures rapides pour nous tous protéger. So before I wrap up, just want to say, for those folks who traveled into orange zones over the Thanksgiving weekend, please, when you leave the orange zones and go back to a yellow zone, wear your mask, bring extra masks to school. If you have students going to school, please make sure they're provided with them, and pay extra attention. Wash your hands even more, pay even more attention to social distancing, pay even more attention to how you cough or sneeze the next couple of weeks. And of course, there are the restrictions on participating in extracurricular activities and sports. Now, all this information is available online, at the Department of Education and Early Childhood Development's website. So please have a look at that, and if you have any questions, don't hesitate to reach out to me. You can reach me at dominic.cardy@gmb.ca, and me or my team will get back to you with the information you need. So thank you to everyone who turned up at schools across New Brunswick this morning and took those extra precautions that we've been talking about. We've had great success battling this pandemic, despite these recent eruptions, which we knew were going to happen. But from the outset, it was never a question of not having any cases of COVID-19, but of limiting their spread and pushing the virus back out. And it looks like we're on the right track, according to everything Dr. Russell is saying, but these next 2 weeks are going to be critical. Alors à tous et tous, s'il vous plaît, pour les prochaines 2 semaines, prends comme sérieux les avis de santé publique. Prends comme sérieux, juste comme vous avez, comme citoyen de cette province, pris les paroles du Dr. Russell comme sérieux les derniers 6-7 mois, qui ont réussi de nous mettre dans une position assez enviable en comparaison avec les autres pays partout dans le monde. On peut continuer d'être en avant, mais c'est à nous de décider notre avenir. Alors, s'il vous plaît, porte les masques, lave tes mains, utilise la distanciation sociale et on peut survécu cette pandémie et finir avec toutes ces restrictions et retourner à une vie assez normale aussitôt que possible. Merci beaucoup.
Good afternoon. Bonjour. For many of us, this Thanksgiving was different and perhaps a lot quieter than usual. I hope everyone was still able to enjoy the long weekend but following the rules all the while and the rules of the particular health zone that you were in. I want to thank everyone who has been working hard and putting in long hours since these outbreaks have begun. From the workers in the impacted special care facilities to lab workers processing COVID-19 tests, from border enforcement staff to all the civil servants who have been working behind the scenes. Merci à tous les gens qui fournissent leur part d'effort depuis le début de ces inclusions. I know the last week has not been easy, especially for those living in Zone 1, the Moncton region, and Zone 5, the Campbellton region. For now, these zones are in the orange level, and the rules in place are stricter than the rest of the province, which remains yellow. We're asking all New Brunswickers to continue to do their part. Be diligent, care for one another, care for yourself. I feel strongly that the rules we have put in place are not unreasonable. They may be inconvenient, but they are certainly necessary. But those in the orange zones do have to take additional precautions. This includes wearing a mask in all public spaces, both indoors and outdoors, where people gather. It means limiting contact to 2 household bubbles, which can extend to include caregivers and immediate family members. Dans les zones 1 et 5, les rassemblements à l'extérieur doivent se limiter à 10 personnes ou moins, et les gens doivent respecter la distanciation physique. Les services religieux, les mariages et les funérailles qui se déroulent à l'intérieur doivent également se limiter à 10 personnes ou moins. No matter which zone we live in, all New Brunswickers must wear a mask in indoor public spaces. We have received many messages from New Brunswickers over the weekend, and I know that not everyone agrees with the rules that are in place. I hear these concerns, and I understand that some people feel the regulations are too restrictive. I also know that some people will take special efforts to avoid the rules or to maybe do things that are outside of the current public health recommendations. I just wish to caution each of you that we don't know when many places, I think 30% of our individuals are asymptomatic. So you don't know if you're a carrier, and you don't know who you may impact or who you may infect. We have to be cognizant of that risk. We have been successful thus far because everyone has participated in the success story. And in order for that to continue, we must all do our part and do it diligently. But regardless, our rules are not optional. They're in place so we can keep the pandemic manageable in our province, as we have been able to do thus far. Nous avons vu à quelle vitesse le virus peut se propager dans une communauté, et nous devrons prendre des mesures pour ralentir la propagation. Tout le monde doit respecter les directives de la santé publique ainsi que l'ordonnance d'urgence. It is just as important that those of us living in the yellow zones follow the rules that apply to us. If we do not, it won't be long before more areas of the province have to move to orange as well. If you don't want to follow the rules for yourself, please do it for loved ones, friends, and neighbors. And find a reason to protect yourself as well. Do it to protect the people in your community who are most vulnerable. C'est le temps de penser aux autres. Personne ne peut changer cette situation tout seul. I know it is difficult right now, and I know that everyone is concerned. We are already seeing the benefits of your hard work. For example, the case numbers in Moncton have dropped significantly. Let's just hope this trend continues. Let's hope we're talking about days and weeks and not months of being in an orange zone. That isn't to say there won't still be challenges as our testing continues, and we will continue to be diligent in that regard. But together we can once again flatten the curve, and together we will see New Brunswick continue to rebound beyond COVID, because that is our ultimate goal, to stay healthy, to be economically strong, and to have a future right here in New Brunswick. We've certainly seen signs of that from across our country, people looking at New Brunswick for the first time. This is no time to lose that initiative or that momentum. This is a time for us just to focus and be able to once again have success in reducing our outbreak and eliminating it. But we know we'll continue to be diligent until a vaccine is found. So life with COVID is here for a while. Let's get used to it, let's manage it, and let's be successful. Thank you. Merci.
Thank you all. Merci à toutes et à tous. Nous allons procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste peut poser rien qu'une question. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Each reporter will only have one question. Jean-Philippe Hugues, Radio-Canada.
Oui, donc ma question est pour le Premier ministre Blaine Higgs. C'est au sujet des travailleurs essentiels qui ont l'autorisation d'entrer et sortir de la bulle atlantique sans s'isoler. Pourriez-vous préciser si vous comptez peut-être changer les paramètres et qui sont les travailleurs présentement qui sont autorisés à faire cela?
At this time, we're evaluating the extent of the essential worker travel. We said that last week in one of the press releases that we were basically auditing everyone that's moving and why. But I think it's important to recognize that we are following up to see not only why people are traveling, but the fact that they're following all protocols in their place of work. It's extremely important that we continue to do both. It's extremely important that we continue to have the ability to move around our province and to support the services required, to continue to have our economy move and be managed. But it's extremely important that people recognize whether they're in an orange zone or a yellow zone, they have to take extra precautions in every bit of their daily activity. And as was said here earlier today, that in some cases, you know, the concern is that we let our guard down during the day, whether it be in a break, whether it be at noon, whether it be outside of the actual workplace, while we're still outside of maybe where we live. The importance is we can't let our guard down at any point during the day, whether it's in essential workplace or whether it is traveling to and from. It has to be a diligent, planned exercise where we are following public health rules all day long.
Monsieur, Tom Bateman, Telegraph Journal, Times and Transcript.
Hi there. I got a question for Dr. Russell, I imagine, on the guidance regarding door-to-door interaction. We saw some reports in Moncton of door-to-door salespeople, which I think is especially kind of questionable during the orange phase. Is there specific guidance for this kind of door-to-door interaction, particularly during the orange phase? And also, will you and your department be providing more guidance for communities about Halloween, specifically how communities in the orange phase? Thanks.
That's two questions. Which one would you like?
If you're making me pick, then I'll take the first one.
Hi, Tom. It's Dr. Russell. I'm going to answer both with one answer. How about that? You got two for one. As of right now, we do have guidance on Halloween in each phase that's going to be released publicly. And basically, in the orange phase, there is no door-to-door. So I know children in the orange phase, if that's the case, because we laid out the protocols when we were all in the yellow phase, knowing that we wouldn't necessarily all be in the yellow phase when Halloween rolled around, because anything can happen at any time. So we wanted to be prepared for all the different scenarios. So as of right now, if a zone is in the orange phase, then they would not be trick-or-treating. There would be other ways of celebrating Halloween. Is that helpful? So there's no restrictions on door-to-door. You have to keep your physical distancing. You have to wear your mask in all public spaces. And our guidance specifically on Halloween will be posted later today.
Great. Okay. And if you're selling new phones or whatever from door to door, as long as you've got a plan and work safe, so it's okay. We're good.
Consult WorkSafe, yes.
Thank you, Mr. Bateman. Vicky Hogarth, CHCO, Charlotte County TV.
Thank you, Bruce. My question is for Premier Higgs. Premier Higgs, some town councils in rural areas in particular have either lost quorum or are on the verge of losing it, in part due to extended terms during COVID-19, but also because many town councilors are acclaimed in the first place due to lack of interest. Have you thought about amalgamating local service districts with municipal government to ensure there are a healthy number of interested candidates before the May municipal elections?
Yes, I think that in terms of local government and the exercise to attract candidates, I think now that the date is certainly official, that people know when to expect it, I think not knowing that was also a bit of an uncertainty. I commend those that have allowed their name to stand and continue to offer in public service during the length of time. I think generally people are understanding why, especially right now, that we're moving to the spring date. And we would be looking for good representation, and I think all part of local governance and understanding what works is recognizing the challenges that many areas are having in finding candidates for representation. So one way or another, we have to find the ability to succeed in that regard, and I think it's all part of how we understand our local governance and move forward in kind of a different time and place.
Thank you, Premier. Thank you, Ms. Hogarth. Andrew Watt, Telegraph Journal.
Dr. Russell, can you talk to me a bit about the retirement home, please? I'd like to understand, do the residents have private rooms and private bathrooms, and why have you declared an outbreak after only one case?
Hi, Andrew. So our protocols around outbreaks in these types of facilities are that because it's a vulnerable population, we have to declare an outbreak based on the public health risk assessment. And so they are in an outbreak situation, knowing that, again, it's a vulnerable population. In this particular setting, they are shared rooms. And so we are, again, rapid testing all the staff and residents this morning. And then they will be working on the same approach that they've used in all the other high vulnerable settings with the prompt team. So in terms of the approach, again, very similar approach. We will be again testing every couple of days. It is a different level of care facility than the one in Moncton. So again, we have to tailor our approach based on the different level of care that's provided there.
Thank you, Mr. Wall. Laura Lyle, CTV, excuse me.
Hi there. This question would be for Dr. Russell. A few times yesterday, it was said that the next 14 days are incredibly critical to the management of these outbreaks. I wonder if you can elaborate a little bit on why these 2 weeks are so important and what the worst case scenario could be if we don't follow these new protocols.
So the entire time that we've been in the pandemic, we look at everything in 2-week cycles because that's the incubation period. And in other outbreaks, again, we look at the incubation period, and even in the measles outbreak, whatever the incubation period is, we look at 2 full incubation periods before we can declare an outbreak over. Obviously, in a pandemic, the pandemic won't be declared over for quite a long time, but certainly in the individual outbreaks that we will see in New Brunswick on an ongoing basis, but hopefully very few and far between until we find a vaccine. Each outbreak in and of itself can't be declared over until there are 2 incubation periods, which would be 28 days actually, of no new cases. But what we do, based on the fact that, again, we understand so much more now about the transmission of COVID, the contact tracing, the testing, the isolation components, et cetera, that we can reassess things on a very regular basis based on the numbers and based on the fact that our positivity rates are very good in terms of that testing, and the contact tracing is working. We don't have issues with hospital capacity, et cetera. So at this point in time, when I said 14 days, I was really speaking about 1 incubation period to reassess and make decisions about moving forward. But we take all that information into account with our epidemiologist team, because they are the ones who crunch these numbers and look very, very closely, not only at our own province, but things that are happening across the country, just outside our borders, et cetera, and in terms of assessing risks moving forward. So we will be having ongoing conversations with our medical officers of health, with our epidemiologists around how we are doing, how the numbers look, and we'll go from there.
Thank you, Ms. Lyle. Clara Pasica, Times and Transcript.
This question is for Dr. Russell, although the Premier has also alluded to it, so your comments would also be welcome. Some hair and beauty salons in Zone 1 and Zone 5 are unhappy that they have to close, but restaurants, bars, and strip clubs can stay open despite already knowing exposures having occurred in these sectors, in the case of bars and restaurants in the Moncton region, as well as some very problematic outbreaks in strip clubs in other areas of the country. So can you please describe how the risk assessment was conducted in detail to determine which businesses should close and which should open, including the industries that I've just mentioned?
Sure. I just realized I didn't finish answering the last question around worst case scenario, and I'd rather talk about the best case scenario, actually, in terms of being more positive. But if the things go well in the outbreaks right now in these 2 zones, in terms of the close contacts having been traced and isolating at home, that the only new cases that we would see would be known contacts that we were supervising twice a day anyway, and they weren't in contact with anybody else, so they can't transmit COVID-19 to anybody else because they're self-isolating at home. That is the best case scenario in terms of keeping the numbers small and keeping this outbreak very short. So if those things don't occur, then we would see this prolonged and more people being impacted, and so that would be not a desirable outcome. And certainly, if we're going to go through this pandemic and people talk about a second wave, I don't really want to see this be a second wave. I'd rather just see this as some individual outbreaks that we manage, that we contain, and then we move on and deal with whatever comes up in the future. So coming back to the risk assessments around the hair. So basically in the orange level, the reason those zones are in orange in the first place is because a risk assessment was done about the risk of community transmission because of the vulnerable settings involved and the contact tracing that was underway, and the information around the risk assessments for both of those regions we did talk about in previous press conferences and press releases. So the issue around the orange level is that until we are convinced that the outbreak is contained and that there is no community transmission, and we make sure that the contacts are traced and there is no continued ongoing transmission of COVID, we need to just make sure that everything that is in place are designed to decrease the risk of community transmission. So where restaurants and bars are really required to ensure that tables and patrons are seated 2 meters apart, and staff have only short interactions with patrons, and services are provided by hairstylists and salons require close contact for longer periods of time. So that that's where the risk is higher. And I know that many owners of salons have done many extensive changes to their establishments to make them as safe as possible. And I trust that they are as safe as they possibly can be. But in the orange phase, again, there's just that much higher level risk of exposure for the virus. So again, I understand that these measures have a huge impact on individuals and business owners and society as a whole. So again, public health never takes this lightly. We only want to impose measures that are equal to the risk that we are trying to mitigate. So we assess that situation, and we want to make sure that the measures are appropriate for the epidemiology, for the numbers of cases, et cetera, and the patterns of transmission and the population. So public health is offering to meet with New Brunswick Registered Barbers Association and Cosmetology Association of New Brunswick and other stakeholders if they do want to have more information on bringing forward their operational plans for the orange phase. So we're open to that. We're open to having those discussions. And to our knowledge here in New Brunswick, we have not had any transmission of COVID-19 occurring in salons.
Thank you, Ms. Pasica. Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, ma question est pour la Dr. Russell. Je me demandais si vous avez retracé l'origine des éclosions au manoir Notre-Dame, puis dans le Restigouche, en fait, dans la zone 1 et dans la zone 5, collectivement. Sinon, quel progrès avez-vous fait dans le traçage des contacts pour retrouver l'origine de ces éclosions-là?
J'ai presque rien compris de ta question. J'ai entendu manoir Notre-Dame. C'est tout.
Bonjour, m'entendez-vous?
Un peu plus qu'avant, oui.
Désolé, je vais essayer de parler lentement. Je voulais savoir
Non, c'est parce
si
que
vous
le
avez
volume.
retracé l'origine des éclosions dans la zone 1 et dans la zone 5. Et sinon, pouvez-vous nous parler du progrès que vous faites dans le traçage de contacts?
Alors, spécifiquement dans les deux zones ou spécifiquement dans les soins de foyer? Parce que...
Dans les foyers de soins, surtout le manoir Notre-Dame. Puis,
Alors, qu'est-ce qu'on peut vous dire, c'est que le traçage, la recherche des contacts étroits est vraiment, ça va vraiment bien à ce moment-ci. Ça a pris beaucoup d'efforts de toutes les ressources qu'on a dans la santé publique au niveau des infirmières de santé publique et d'autres membres de notre équipe. Alors, ils ont contacté tous les contacts étroits. Spécifiquement, ils vont continuer à faire des dépistages sur les résidents et les staffs. Chaque couple de jours, 2 ou 3 jours, dans la manoir Notre-Dame et aussi le nouveau établissement qui vient juste d'avoir un cas diagnostiqué hier soir. Alors, première chose, aujourd'hui, ce matin, on a fait le dépistage de tous les staffs et résidents dans l'éclosion à Campbellton, dans le foyer de soins là.
Merci, M. Boudreau. Timothy Jakes, Campbellton Tribune.
This is for Dr. Russell. Campbellton Dalhousie MLA Guy Arsenault sent you a letter on Sunday, and amongst other things, he asked for the kind of widespread community testing Zone 5 had during the last outbreak, which were held in 2 rinks in Campbellton Dalhousie. Given the growing numbers, will we see this kind of widespread testing here again?
Actually, no. And so I'll give you the same answer that I gave to Mr. Arsenault. I spoke with him yesterday, and so basically, our testing approach during the first outbreak in the Campbellton region, we did have a lot of close contacts that we needed to trace. We were concerned about community transmission, and I think at that time too, we had only really done mass testing in certain facilities at that point in time. So a couple of different reasons to do that testing at that particular time, but certainly it exercised and operationalized our capacity in terms of moving staff there quickly to operationalize and get people tested. But what we've learned since then is that all of that asymptomatic testing came up with 0 cases. We've seen that across the country in other jurisdictions where asymptomatic testing is just not really garnering results that point to its efficacy any longer from a human resource perspective, but also from a materials perspective and the equipment that we need. So now we know that when you look for cases in places where you expect to find them in high-risk areas, like the close contact of a case, you will have a much higher success rate of of finding further cases that way. So we are having very, very targeted testing for the higher risk areas. And in fact, when it comes to essential workers traveling across the border, we're now offering asymptomatic testing twice a week for those people coming across the border for work every day. And we did do some asymptomatic testing for a while with truckers. Asymptomatic testing right now, we're really, again, we'll do it focused in places like adult residential facilities, long-term care facilities, et cetera. We've done them in daycares when we needed to in terms of looking at the risk and looking at the benefit of doing that kind of testing. And we certainly, from the beginning, testing the right person at the right time for the right reason has always been the guidance from Public Health Agency of Canada around testing. And again, we've learned so much since then, so we're applying all of those learnings from the first outbreak at this point in time. And so far, we've been able to find the close contacts and isolate them and test them when they become symptomatic. And again, in the high-risk settings, like vulnerable populations and long-term care facilities, adult residential facilities, et cetera, we are doing mass testing of those populations, the residents and staff, every 2 to 3 days to make sure that we are capturing all of the cases and being able to monitor that regularly.
Thank you, Mr. Jacobs. Thank you, Dr. Russell. Erica Butler, CMHA, Sackville.
Hi there, thank you. So I've heard from the Students' Union here in Sackville that they're concerned that the guidelines, I guess particularly the 2 household rule, is not something that's easily applied to those living in non-family household situations. I'm wondering if Dr. Russell could give us a version of the 2 household bubble rule that more easily applies to different living situations, like pairs or groups of roommates who may or may not actually spend time together, single people, that sort of thing.
That's a challenge. I think people have to be prepared to be a bit creative about minimizing their risks. And obviously, in those settings, there obviously would be challenges. When we talk about people that are known close contacts and telling people to self-isolate, the safest way to reduce the risk of contact and transmission, if there is a risk, is to not share the same bathroom, to not share the same personal items and towels and utensils, et cetera. So in those settings, obviously they can't move at this point in time. They're in their respective bubble. But certainly respecting where they go outside of their dwelling would be very, very important in terms of limiting close contacts. And so wearing your mask as much as possible when you're outside your dwelling is very important because you don't want to have close contacts outside the dwelling. And when you're in your dwelling, obviously staying 6 feet apart at all times. If you can open windows, that's great in terms of a ventilation perspective. If you don't have to share a bathroom, that's even better. And if you don't share personal utensils, that also will be helpful. And making sure all surfaces are wiped down regularly with disinfectant.
Thank you, Ms. Butler. Thank you, Dr. Philip Dross, CBC.
Premier Higgs, who exactly is able to come to the province without having to self-isolate for 14 days, and how has that requirement changed since the Moncton and Campbellton outbreak started?
Well, certainly, currently, we would have healthcare workers that would be coming, let's say, working up in Evanston, working in the Campbellton Hospital. We could have educators. We had students before that were coming from the Louisquois Nation. That's been closed at this point. But there's also economically, there'd be people coming through our province, going to Nova Scotia, going to PEI, or doing business here generally as part of the economic recovery here in the province. But in saying that, what our due diligence has is that we want to be sure that these essential workers actually are followed, are tracked, so see that they're following the protocols when they get to a destination. And if it's a case of working for a company or a contractor or this, WorkSafe are playing a role here and have from the very beginning in ensuring that the work practices are stringent, and certainly in the cases of zones that are in orange, they are more stringent. And the idea of our rules being followed are just being monitored very closely. A week ago or so, when we said we were going to make changes to our borders between Nova Scotia and PEI, it was to allow more resources and get to be able to monitor the borders between Quebec and New Brunswick, to understand the essential worker practice, and to follow in terms of business practices throughout the province, just to ensure that we have a higher level of adherence. Our previous numbers were in the let's say a high of 45% to a low of 15. We want to see that well up into the 85, 90, 95, and obviously we're targeting full compliance, but some of that's very difficult to monitor for sure.
Thank you, Premier. Thank you, Mr. Gross. Nicolas Steinbach, Radio-Canada.
Bonjour, cette question pour le ministre de l'Éducation, Dominic Cardy. D'abord, juste de préciser, parce que j'ai vu dans le communiqué de la province que Janeville, l'école de Janeville n'était plus dans le communiqué d'aujourd'hui. Est-ce que ça veut dire qu'elle ne fait plus partie des écoles potentielles, potentiellement exposées à la COVID-19? Et puis ma question, c'est, ça va prendre quoi pour fermer une école durant cette éclosion-ci? Quels sont les critères que ça va prendre pour fermer une école pour éviter la contamination dans les zones d'éclosion?
Merci Nicolas pour la question. On a tout ça, c'est précisé sur le plan qui était en place maintenant pour quelques mois et c'est lié aux directives du santé publique. Et s'il y a un cas exceptionnel que dans une école, on a besoin de prendre l'action spécifique, on va le faire, mais en grand, c'est les mêmes règles pour toutes les écoles dans un district, dans une zone de santé. So the rules for closing schools are laid out clearly in the plan that's been out there for months online, the ECD website. We will, of course, go above and beyond that if directed by public health, if that's necessary and required. But all these standards have been out for some time, and our goal is to keep our schools open. And our goal is to keep our schools open in the face of the pandemic. Notre but est toujours d'assurer qu'on peut continuer l'éducation de nos jeunes, malgré l'effet de COVID-19. Et absolument, on va mettre en avant la sécurité de tous les élèves et l'équipe professionnelle. Mais le but est que les écoles restent ouvertes. Mais tous les détails sur les choses précises qu'on a besoin de voir avant qu'on ferme les écoles, c'est tout là sur les plans qui étaient développés dans les derniers mois, qui étaient déjà pas. J'ai discuté ça ici à quelques reprises, Dr. Russell aussi. Alors, rien n'a changé. Merci.
Monsieur Steinbach.
Pour Janeville?
Janeville?
Oh, excuse Nicolas. Sur Janeville, ça c'était un cas possible. On n'a rien entendu. Alors encore, si on n'a pas les cas confirmés, on enlève les écoles de liste qu'on discute à la conférence de presse. Sorry, but so Janeville, which had been discussed yesterday, is a potential case. We're not talking about that today, which again, no news is good news. So anytime that we've got bad news, we'll share it here.
Thank you. Merci beaucoup, Monsieur Steinbach. Thank you, Minister. Brianna James, Northern Light.
Thank you. It might be repeating yourself there, but for Minister Cardy, can you just elaborate on the situation at Janeville Elementary School, and if you could clarify the number of individuals who were advised about the possible exposure of the virus, if they were staff or students?
No. We can't do that because we have privacy rules. If there is a case confirmed in a school community, the school community will be informed. That's how this goes based on the laws that we have to make sure that we don't spread misinformation from our side. On a besoin de préserver l'intégrité de l'information confidentielle des élèves et des membres de l'équipe personnelle. Alors, ce n'est pas possible de discuter le nombre de cas, etc., le nombre d'incidents dans une école. S'il y a les cas, absolument, on va partager ça avec la communauté scolaire, mais seulement les cas confirmés. Alors, c'est pour ça des fois, on discute une école aujourd'hui, peut-être on n'a pas discuté hier, ou on discute aujourd'hui une école qui ne va pas discuter demain. La situation change. Pour toutes les mauvaises nouvelles, nous sommes ici pour les partager. Merci.
Merci. Megan Yamoa, Global News.
Thank you, Bruce. So you had a lot of messages about mandatory masks this weekend. How many emails or calls of concern did you get? What were the concerns expressed? And are these messages being responded to?
I don't have the particular number, but yes, we had a number of questions, a number of concerns about masking, and what was the requirement, and because we have varying opinions. But I think the reward is far outweighs the inconvenience of wearing masks. I mean that's why we've gone this route. Certainly, our colleagues in the bubble are in the same position in Nova Scotia and PEI. They will be responded to. We are going to be setting up kind of a line. We have it already on our website. We have a 1-800 number to call, and we have a response line that answers questions, and if we get individual letters and such. So many of the questions will come that will be repeated, but they will receive a response.
Thank you, Monsieur Moa. Mathieu Wakomo, l'Acadie Nouvelle.
Bonjour, ma question est pour le ministre Cardy. Monsieur Cardy, vous avez rencontré récemment les gens de Black Lives Matter Fredericton au sujet de la proposition d'inclure dans le curriculum des écoles publiques une plus grande partie de l'histoire des Noirs. J'aimerais savoir comment s'est passée la rencontre et puis si vous envisagez véritablement ce changement au curriculum.
Eh oui, merci beaucoup pour la question. C'est quelque chose qui était dans la plateforme du Parti progressiste conservateur de l'élection qui a terminé quelques semaines passées. Alors, c'était vraiment un plaisir de voir cette commitment et cette promesse inclus dans la plateforme. Et en avant l'élection, j'ai déjà discuté avec le groupe Black Lives Matter à Saint-Jean. Alors, après l'élection, j'ai rencontré le groupe de Fredericton et on va travailler ensemble pour développer le curriculum aussitôt rapidement que possible. Aujourd'hui, ça prend des fois 7 ans entre le temps qu'une nouvelle idée pour le curriculum est développée et que ça arrive en salle de classe. De mon avis, c'est un peu fou. En cas de technologie, le monde est en train de changer complètement en 7 ans, aussi en politique. Alors, c'est clair qu'on a besoin d'agir beaucoup plus rapidement et j'ai hâte de travailler avec ces groupes, Saint-Jean, Fredericton et les autres partout dans la province. Et nous sommes maintenant au commencement du processus de développer ce nouveau curriculum et je vais partager tous les détails dans les semaines et mois qui arrivent entre-temps dans la bataille contre COVID-19. So, working with Black Lives Matter, Fredericton and St. John, met with them before and after the election. Really pleased that in the PC's election platform we had a commitment to have a more inclusive and comprehensive civics curriculum that focuses on the good and the bad of the history of our province, including the fact that we really haven't paid enough attention to African New Brunswickers in the past history curriculums and others. So we're going to be working to address that and working to get that curriculum rolled out faster because 7 years, which has been the traditional amount of time, 7 years between an idea and a program hitting a classroom is far too long. Thanks.
Merci beaucoup, Monsieur Roy. Shelley Steeves, Global News.
Yes, my question is for Dr. Russell. Dr. Russell, you mentioned that you'd be willing to sit down with the Cosmetology Association of New Brunswick to discuss their concerns. I know they're concerned about 1,700 of their members in Zone 1 alone have had to shut down and no longer able to operate. Is there anything that this group can do to step up their safety procedures and their protocol that they're following on top of what they're already doing that would allow them to open even though we are still under the orange stage? And if so, what would they have to do to see that happen?
So as of right now, again, the offer's there to meet with them. I can't make any promises at this point in time. The risk assessment around what should be open and not open in the orange phase have been done over the course of time, and in fact they were revised. So the first set of phases that we published online early on in the pandemic was revised based on reassessing the risks and the benefits of each of the different types of measures from a mental health perspective, from a risk perspective, from an economic perspective, et cetera. So we were very, very sensitive to the fact that whatever phase we're in, it has to be the most beneficial with respect to balancing the risks and the benefits of each of the different public health measures. So for instance, in our red phase, if you look at the if you were to compare the first version of the red phase and the second version of the red phase, the first version of the orange, and I think there's a peach color phase, and the new version, everything has been rejigged again, aligned with what we know from the first few months of the pandemic. And again, how do we mitigate all of those risks that have been identified and assessed with the appropriate public health measures? So I can't make any promises that we would make any changes at this point, but it is an evolving situation. And when we do get new information about risks and research, et cetera, we do incorporate that into our messaging going forward, and we do incorporate that into our policy recommendations. So it is not a static situation, nor will it be until there's a vaccine and we are all have all received it. So it's an ongoing issue.
Thank you, Ms. Steeves. Thank you, Dr. Nathan DeLong, Miramichi Leader.
Good afternoon. This is a question for either Premier Higgs or Dr. Russell, whichever one of you can answer. In recent days, we have seen an outbreak involving players on 2 Quebec-based hockey teams with the Quebec Major Junior Hockey League. I'm wondering if you're worried about this being an issue in New Brunswick, or how this might impact organized sports programs in the province.
The most up-to-date information I have right now, I think there were discussions that took place yesterday with one of the hockey leagues, and I was not aware of the cases, but we can definitely look into that further, and we can address that in terms of any further risks. The conversations we had earlier in the weekend were around which games could take place in what settings that had already been planned based on the yellow phase in Moncton and the yellow phase in Campbellton. So those were the things that we were discussing over the weekend, but I don't have any more up-to-date information other than that, but I can follow up and come back to you with any new information that I have.
Thank you, Mr. DeLong. Mia Urquhart, CBC.
My question is for Dr. Russell. You said the original Moncton outbreak case is travel-related. So that leaves two options. One, someone came back to New Brunswick from outside the bubble and was not required to self-isolate, or someone came back, was required to self-isolate, but did not. In an effort to learn a lesson from this outbreak, can you tell us which one it was and what that person did wrong?
Well, I'm hearing your question, and I'm hearing the words of your question being a bit challenging with respect to moving forward in a positive way in terms of the ongoing outbreak and the ongoing risks to the population. Throughout the pandemic, there are only two ways for people to, actually there are three ways. There are three ways that people can get infected with COVID-19. They can travel outside the Atlantic bubble and be exposed that way. And when they come back, they can even be self-isolating, but not necessarily be self-isolating completely appropriately. And sometimes people need a lot of support to self-isolate properly. And so I think we cannot really point fingers. I think we just have to know that each and every person in New Brunswick can be infected from either a close contact that they are aware has traveled or not, because again, it can be a household member of somebody who traveled or even somebody who had an exemption. There are many different combinations and permutations here, including community transmission. So if somebody traveled somewhere where there was community transmission, or if if we did eventually have community transmission in New Brunswick, that can also happen. So moving forward, the only lesson to learn is that we have to be vigilant whether there are cases in New Brunswick or not. We have to behave like COVID-19 is here and will always be here until the pandemic is over and we all have a vaccine. So, and in the meantime, we have to be kind, we have to follow the public health directions, and we have to support one another. Again, there are challenges that are faced by each and every individual in this province that are different based on where they are at. With respect to vulnerable populations, with respect to the hardships that certain people might face, with respect to their work environment. They might not have benefits to be able to stay home when they are unwell. They might not have the appropriate means, again, for whatever reason. So I think in this case, we have to be supportive and we have to assume responsibility for ourselves as individuals in terms of what we can do to contribute to minimizing the risks of COVID-19 in our province.
Thank you, Ms. Urquhart. Michel Corriveau, Radio-Canada.
Bonjour, merci Bruce. C'est une question pour le Premier ministre, M. Higgs. Alors, M. Higgs, j'aimerais savoir, il semble y avoir des rapports que les gens ne respectent pas nécessairement le port du masque obligatoire, en particulier dans certaines zones oranges, à l'extérieur par exemple. Alors, est-ce qu'il y a des mesures particulières qui peuvent être prises que vous prendrez peut-être pour obliger les gens à respecter les règles? Et si oui, quel genre de mesures pourraient être prises?
We've said before that we wanted people to use common sense to protect each other and certainly be part of the solution and not part of the problem. And so We are getting some complaints. I won't say a lot, but there's some. Our officers are out and looking at the extent of any sort of violations of our current orders, whether it be in the orange zones or yellow. Those situations are being addressed directly with the individuals, whether it be in a business or an event of some sort, to ensure that they are following protocols. So the first part of all of this is kind of persuasion and let's certainly adhere to the rules. There's no reason not to. There's no reason to risk yourself or others. There is, as you know, in the Emergency Measures Act, there is ability for fines and enforcement. We know that we cannot catch everyone, and I would like to think that people won't feel any certain amount of success if they haven't been caught directly, because having a success that's not really a success in the real terms, and we end up with infecting people, isn't what we're expecting from individuals in our province. We've had tremendous response and adherence thus far. We can't lose it now. I think we likely got a little complacent over the last few months because it was a relatively quiet summer and early fall. And so this is indeed a wake-up call. COVID is here, and it's here to stay until we have a vaccine or we have some very effective treatments. And at this point, anyone who thinks that they are getting away with something by not following the rules is only hurting themselves and their friends and neighbors and those that could be closest to them. But we will be watching, we will be encouraging, and we will be enforcing if indeed it comes to that. I'm hopeful it won't.
Merci beaucoup, Mr. Corriveau. Eilish Boning, CTV, sorry.
Thanks, Bruce. Mr. Higgs, to kind of continue off of that, what sort of enforcement will we be seeing then? Are we talking, you mentioned fines, jail time, that sort of thing. Are those options for us? And if so, when will we see those be implemented?
Well, I think right now we've had a case where in our Emergency Measures Act, and it's been there for some time, that there is an enforcement mechanism that has been utilized in terms of fines. We're certainly enforcing, turning people around and putting them back on a plane or not allowing them to be here unless there's a particular reason through essential travel or services or living here. The idea is that the mechanisms are there, and I think they are laid out, and we have implemented some fines over the past 6-7 months. But I guess I only reiterate that we will never be able to control this in a way that we must through an enforcement mechanism. That doesn't mean we aren't willing to do that, and doesn't mean we're not going to be scrutinizing events, scrutinizing businesses, scrutinizing, how people are conducting their everyday activities, and the fact that businesses are following work-safe practices, because we will. But I just reiterate that I'm hopeful that we will be able to get a full compliance based on the New Brunswickers' willingness to be part of this solution.
Thank you, Premier. Thank you, Eilish. Shane McGee, CBC.
Yeah, this is a question for Dr. Russell. There were 4, I think, locations here in Moncton, Costco, St-Hubert, McDonald's, and a community center where there were warnings about potential public exposures. Have there been any cases traced back where people were exposed there and did contract the virus at any of those locations that you've issued notices about?
Well, for confidentiality reasons, I don't really want to say if that's the case. I guess I will confer with my colleagues if I can share that. But I guess what I can say is that all the contacts and cases have been traced. The good news is they're all linked. They're all linked to travel. Therefore, it's not community transmission. The good news is the contact tracing is working. Our testing is working. The only people we're expecting to see in terms of new positive cases in the Zone 1 are people who have already been identified as close contacts to cases, and they're already self-isolating, and therefore they cannot transmit to anybody else. So that is the good news. All of the communications that we've had so far have been successful in terms of reaching the population. Public health has been successful reaching the close contacts. So everything in the process and everything in the system that can work well has been working well thus far, and I do hope for that to continue.
Thank you, Mr. McGee. That concludes today's update. Merci beaucoup. Cela conclut les séances d'aujourd'hui. Thank you very much.